Migraine Monday, the moment we've all been waiting for. We're gonna talk about drugs. I'm just kidding, but actually kind of not. We really are gonna be talking about the medications that we get prescribed and often try in an effort to treat chronic migraine or episodic migraine, whatever your fancy. Generally speaking, in an effort to treat migraine, we would be prescribed blood pressure medication, anti-seizure, or antidepressant. There is a dog following me, which is hilarious. I think this dog wants to know about migraine as well. There are medications specifically prescribed to try to prevent migraine and also lessen the intensity of the migraine episodes. But there are also onset medications, which they call abortive. So we're going to be talking a little bit about both of those items today. And I'm going to hopefully try to get a little bit more in depth about my experience with that. Traditionally, the medications used to try to prevent and also lessen the intensity of migraine, that was all the option there was for us. That was it. And I felt like I was always trading one problem for another. Either I was exhausted and couldn't move, which I still had migraine episodes. It didn't even help me personally. Or I just was like a zombie. Topamax made me feel so weird. I was shaky. People would always ask me, "Are you okay? Is something going on?" And I'm like, I mean, that's a long answer. That's why we have Migraine Monday. Then we have abortive medications. And these medications traditionally came in the form of painkillers, which really don't work, or Triptans, which primarily I have been using. Relpax 40 milligrams is the one that generally has worked the best for me. Imitrex usually doesn't do the trick, and if I take one, it's like sometimes it may work, but usually not, and it's pretty bad. These were pretty much all the medications we've had for a really long time. And then of course we can talk about vitamins. What vitamins do we need to be taking? Well, if you have migraine, you probably already know this. We're supposed to be taking a lot of magnesium, riboflavin, CoQ10, feverfew. I think that's most of them, but I'm probably forgetting one off the top of my head right now. Needless to say, all of these medications I have been doing for very long, for many years. Have I seen a significant amount of decrease in migraine? No, because I'm a chronic migraine patient. They have said that once you get chronic migraine, it's really hard to address it. So what they call people like me are intractable. It means that it's really hard to manage, gets in the way of your life, and they really haven't seen any significant improvement over several years, right? Now, Triptans like Imitrex, Relpax, Trexamet, there's a lot of them. Maxalt, it's kind of a mild one. Well, they usually work for about 24 hours. However, there's a downtime. Like once I take one, I feel really exhausted and I'm probably going to be out for a couple hours. And then you might see me like playing music or doing something because I'll be like, okay, it kicked in. I'm doing a little better. Until recently. They discovered CGRP, and I mentioned this briefly. It is a protein chain that I guess once it's activated, it causes severe inflammation in your head, giving you migraine pain, suffering. A couple years back, they started doing trials on a medication called Aimovig. It was the first ever medication designed specifically to prevent migraine, because as we just said, all of the migraine medications that have been prescribed are designed for something else, but they found over the years or over time that it was helping people with migraine, so they would prescribe it. Studies have shown people like me, some people with chronic migraine, have seen a 70 to 80% reduction when using Aimovig. Now that I'm a bit cold, I am going to make a little fire with some tea to finish off what we were talking about.
All right, so obviously they have been desperately needing a medication that was designed specifically for migraine over the last several years. I've mentioned before, and I'll say it again, I honestly can't imagine growing up in a day with migraine and not having even triptans, because triptans came on the market and changed the game for a lot of people. Traditionally, painkillers and things don't work. They're not effective. I've had injections of Toradol, which is just kind of like ibuprofen. It's just much stronger. And it would maybe take some of the edge off, but honestly, it wasn't gonna be enough, especially for my most severe migraine days where I was just absolutely out of function. However, I will say, you know, I've tried a long list of medication. I honestly won't even be able to name them all. I will say every single one, I felt like I had a lot of side effects. And the problem was I wasn't seeing any difference with migraine either. So while I'm trying to take these things, I'm not seeing any change in my pain and days amount of time having migraine. That being said, there was a time with my migraine, which I mentioned in a previous video, where I felt really hopeless, and you know, many days I feel this way, and I can't imagine if you're suffering from chronic pain or you know somebody who is, it's one of the saddest and hardest things to go through, and you start questioning your quality of life. I definitely questioned the quality of my life and knew that it was not obviously what I would plan for myself, but because I have faith in God and I have really worked on my spirituality and trying to get out of myself and help other people and just be mindful. And that's why I started connecting with the migraine community as well. I luckily found some acceptance from having chronic migraine, as well as being able to not feel so alone and hopeless. So even though my quality of life maybe hasn't been the best in the last several years, if I would have taken my life, I wouldn't have lived to see the day where they found CGRP. I'm going to try to pronounce this, okay? It's called CGRP, and it stands for calcitonin gene-related peptide. Not too bad, right? There are 3 major preventatives out now that are attacking CGRP, and they're called Aimovig, Emgality, and Ajovy. They're actually working on an infusion one. It's going to be called Vyepti, I believe. And that one's only going to be needed to get an infusion every 3 months. I just got my first shot, and it was of Aimovig. And I want to tell you guys a little bit about that. Before I do, I want to jump over to some abortive medication. So I mentioned before that they prescribe mainly Triptans for people like me, which was a huge development. My mom, when she was younger, didn't have access to medications like Imitrex, Relpax, anything like that. So she was struggling to a whole nother level. And if I was in that time frame, I don't know if I'd be here today. It's pretty terrible. And even with the Relpax, I've had many stays in the hospital and not been able to attack my pain. However, they usually last for about 24 hours. So let's move forward. They just came out with a couple abortive medications attacking CGRP, such as Nurtec, and then there's another one called Ubrelvy, which you might have seen Serena Williams. She's been on their advertisements and has reported that it's given her less downtime and that she's been able to go back on the court. So let me just say this. I have tried so many medications, so many treatments, non-medications, holistic. This video we're doing is just about medications today. But just know that when you're like me, I'm sure some of you can relate who are watching this. When you're like me, you lose hope. You're like, okay, that's really sweet of you to think that I'm gonna somehow be cured. I really appreciate that. But it's been 15 years or more, or whatever it's been. And no offense, but I've had to accept the fact that I may not ever find a cure because my life has been so severely impacted. They came out with these medications, including Aimovig, the injection, which is a preventative. So the first couple of medications that I described are shots. Aimovig, Ajovy, and Emgality are now once a month injections. You give yourself, you get it from the pharmacy, and it attacks that CGRP. And the reports are 70 to 80% decrease in migraine among all migraine patients. This includes people like me with chronic. Now, I'm sorry to be the negative Nancy, but when I heard this, I was like, oh yeah, right, I'll see it, or I'll believe it when I see it, you know, kind of thing. And I still kind of am. I never thought after several years, a decade of suffering, of not being myself, of not being able to participate in life, I would see a medication, okay, that could possibly help me. It's just been a really long road, right? Almost 2 weeks ago, I ended up in one of my most severe migraine attacks. I took 4 Relpax, which the recommendation of taking Triptans are 9 a month. And if you're a chronic migraine sufferer, I'm sure you're laughing at that. That is hilarious and sweet, and oh, how thoughtful of you. I have an everyday pain level. I am somebody who suffers at some extent every day for the last decade. I'm sorry for laughing, but when you take 4 Relpax and you are on the floor and still in severe suffering pain, I don't even know how to explain that. It's just, man, you'll really start questioning some things at that point. So needless to say, I took some other medications, including Benadryl, Benadryl is also prescribed in an effort to work with your migraine medication because it's a low-grade sedative. So oftentimes if you get hospitalized, they'll give you some Benadryl in your IV along with Toradol, and then usually an anti-nausea medication. I haven't even touched on anti-nausea medications, but I do have some at my house for this specific reason when I'm on the floor and my migraine is, out of control, and so I'll usually take a little anti-nausea as well. So this specific episode that I'm talking about is, it's up there with one of the worst I've ever had. I remember being on the floor at my grandfather's house when we lived together, crying, screaming, in pain, nothing was working, and he would choke up taking me to the hospital. To put him through that, to put other family members through that, it's just a really tough thing. Now, this specific migraine, I had to call my brother and have him bring me to the neurologist. It was my first neurology appointment because I hadn't had insurance because I'm a singer-songwriter full-time. Some of that is because of the migraine, because it took away my ability to have like a predictable life schedule and things, and music ended up being my full-time job, and I didn't have insurance. So I was caring for my migraine myself because I kind of knew how I've been through the ringer over this last several years, and so I was treating myself with the exception of sometimes being hospitalized or in urgent care. And my brother takes me to this appointment, and the hope was I was going to get one of these shots that we've discussed in this video. And I just was like, please, I've done everything and I can't wait any longer to try this medication. When we got there, I was so emotional. I'm like crying in the office, waiting to be seen. I mean, I had the worst ever migraine the day before, and I'm still in pain at this point. And I get called in the office, and I'm sitting there and they ask me everything that I've tried. Sorry, this is like choking. This is hard to talk about a little bit. But anyway, I had tried 2/3 of the list of things that they use for people like me. 2/3 of the list, and the only reason why I didn't try the rest is because they're like, there was no point in to prescribe you anything if it wasn't going to work. We've already tried all that, so it wouldn't have been effective. So they said, you're going to get the shot today, because the only requirement is to try 2 before we get the shot. I am not that hopeful just because, like I said, I tried so many things before that I'm like, yeah, I know there's claims that this helps people, but I'm not going to get my hopes up. So she gave me a Nurtec, which was a dissolvable tablet, in order to try to fight the pain that I was in from the night before and everything. And also she gave me a nerve block. And when she gave me that nerve block, it's like a shot right in the nerve in the back of my head. It was like immediate. I just felt some sense of relief right away. And I was like, I feel a little better. So she also then explained to me how to use the Aimovig injection. It's a refrigerated injection. You take it out for about 30 minutes before injecting, but it's an auto injector. I did it in my thigh, which I will promise you on my next injection, I'm gonna do a video and show you how I inject myself. I will explain it and everything and do a little bit more of a review on the Aimovig at that point, because I've been keeping a log, a diary, But I will say this, it's hard to tell because I have seasonal attacks that last for a lot longer and much harsher. So sometimes like the fall is a really bad time for me. I end up getting severe pain, severe attacks, and same with the spring. It has something to do with the atmosphere and the pressure, and it causes people with migraine to have sometimes some more significant pain and attacks. So it's hard to tell if what I'm about to say is because of Aimovig or if it's because of the change in pressure. However, I have seen a significant change in my life in the last 2 weeks. Sorry. After getting the injection, I walked out of there. I didn't feel pain anymore. And I went home and I woke up the next day and I had no pain. No, zero. Done. I didn't have to take another Nurtec, which is the dissolving tablet. It's a CGRP medication designed to help, kind of like Triptans do, except for now they say that the Nurtec lasts for 48 hours, whereas a Triptan will only last for 24. I can't tell you how effective they are in comparison to a Triptan because I haven't had such a severe attack like I did on the Tuesday leading up to getting the Aimovig injection, which I'm like, it could be a result of having an Aimovig injection that I haven't had a severe attack, or it's just happenstance. But I will say this, my sleeping schedule since getting Aimovig has significantly increased. I had a hard time sleeping. It's part of living with migraine. My sleep is interrupted. I have a hard time regulating my temperature. But since getting the Aimovig, feel like I'm much more rested. I haven't had a severe attack. I've only had to take one medication in almost 2 weeks. That's unheard of in my history. I live in chronic pain every single day for the last decade. And I get this injection and I've gone almost 2 weeks with only one time having to take something. That's like kind of I promise to do a more in-depth analysis of the CGRP medications, as well as give you a demonstration of how I inject myself in the future. But for now, I hope you got something out of this video and that you enjoyed it. Please leave your comments if you want more detail about something or you have a question. Please let me know. And I'll see you next time on Migraine Monday. Woo! See you soon.